is the line so drastically long like this? I don't understand it.
The Black Doctors COVID-19 Consortium is struggling to meet an influx of demand after the city severed ties with its largest vaccination partner.
Right now, there's like this huge wave. Everyone wants it. We don't have enough supply for the demand. We're getting 1,000 doses a week. There's over 35,000 people signed up, which would mean it would take us 35 weeks or greater than 2/3 of the year to get there.
Dr. Ayla Stanford founded the consortium to service Black communities who were hardest hit by COVID. Now, a recent scandal with Philly fighting COVID is further complicating her efforts to get the vaccine to Black Philadelphians. Last week, the city cut ties with PFC as its largest mass vaccination partner. The startup was run by a 22-year-old with no medical credentials who admitted to taking home several vaccine doses for his friends.
What's happening is a lot of the people who are coming got their first dose from PFC and they're panicked and they're wondering how they're going to get their second dose. PFC shutting down has been tough because the purpose was for us to be in Black communities where the impact had been the greatest. I can vaccinate anyone who wants it, but I need more vaccine because I can't afford to widen the health disparity by now not taking care of the group that needs it the most.
There's no other way to read that debacle than someone in the system giving a wink and a nod to someone and looking completely past qualified, credible sources.
Reverend Dr. Alan Waller says the debacle with PFC only reinforces distrust in Black communities.
Black people and vaccines, we have a righteous skepticism because of our history with the medical community and just recently what we've experienced. We've had good reason to raise concern. Our own local government showed the problems, the historic problems of racial disparity and foolishness when they awarded the Philly fight piece to a 22-year-old non-medical student and went past a proven methodology in our community. On some level, this is her cleaning up the mess, and the question is, will the city help build capacity around her so that she can do it effectively?
On Tuesday, the city announced it will open new mass clinics later this month. The city plans to vaccinate 500 people per day.
We collectively are up for the challenge. We just need more vaccine, more personnel, and sustainable funding to get it done.
In the meantime, community leaders say attitudes toward the vaccine are already starting to shift.
I believe that we ought to take the vaccine, and most people are beginning to believe that.
You know, I was going to have the vaccine, or I was going to die of something else. Who knows? I'm 76 years old. It just outweighs the pros outweigh the cons.
Reading that they're not injecting COVID into me. They've isolated the protein, so that was helpful. And also, I've been following Dr. Stanford, and so I put some trust into her that she was actually thinking and caring about this community, and so wasn't going to do something to harm us.